Have you ever faced these kind of situations around your family and friends? Then this video is for you. Tell me one thing, what are the conditions that you have noticed in the previous video? Exactly, those are bleeding gums and bad breath. In few people, there also be a conditions which may present like swollen gums or red gums, receding gums, loosening of teeth, discomfort or pain, or sometimes there may be a pus formation between the gum and teeth along with bad breath and bleeding of gums. So you may have a doubt, what are these diseases called? Why these diseases cause? So without delay, let me tell you the causes and the symptoms and how to prevent it and the treatment for those diseases. I am Madhumala, studying in third year of RV Dental College. So firstly, I want to tell you what is periodontal diseases means. It is a chronic bacterial inflammation which affects the gums and the bone which supporting the teeth. In simple words, we can say this is a disease which affects the surrounding of the teeth. So what are the periodontal diseases? So firstly we have gingivitis, which is the inflammation of the gums but there will be no bone loss. Next we have periodontitis, which is there will be an inflammation of gums as well as bone loss. This has two types, chronic periodontitis and aggressive periodontitis. In aggressive periodontitis, there will be a rapid progression of the bone loss when compared to the chronic, whereas in chronic it is less compared to aggressive. And lastly, we have necrotizing tissue damage diseases, which leads to tissue death as well as losing of the tooth. After hearing this, you'll be having a doubt, right? What are the reasons to cause these kind of diseases? Well, there are many reasons. Number one, we have poor oral hygiene. As we all know that brushing is our daily routine, but not brushing properly is of no use, right? So if you don't brush properly, you'll be having a chances to get periodontal diseases. Number two, we have chewing or smoking tobacco. So chewing or smoking tobacco increases a risk of getting periodontal diseases. I know chewing tobacco gives a pleasure to few people, but they don't know it also gives pain and regrets in the future. Number three, we have genetics. Some individuals genetically are more prone to get periodontal diseases. It is also caused due to some medical conditions like diabetes and use of some medications, poor nutrition and obesity. There are certain factors which increases the risk of getting periodontal diseases, which is called risk factors. It includes diabetes, stress, poor oral hygiene, heredity, obesity, and taking some medications which causes dry mouth, and some underlying diseases, autoimmune disorders like AIDS, and in female hormonal imbalance such as in pregnancy and use of oral contraceptives. You'll be thinking, right, doctor, you're telling everything how it causes and how it affects your daily routine and everything, but you're not telling how to prevent it. Well, I'll tell you few preventive measures which do not prone you to get periodontal diseases. So you can avoid it by maintaining a good oral hygiene. Changing your lifestyle into a healthy lifestyle includes say no to tobacco and regular dental checkups, and manage medical histories, and avoid grinding of teeth. Stay hydrated and consider genetic factors. Like if you have any family history of gum diseases, then be careful with the causing factors. Few patients will be like, doctor, I don't have time to do all these preventive measures. What if I get a disease? How to treat it? What is the next step? So, if you fail to do a preventive measures, then we can treat it by professional cleaning like scaling and using some agents to remove plaque, and some using medications like antibiotics and antimicrobial mouthwashes, and also by using laser therapy, and some surgical procedures like flap surgery or bone or tissue grafts in severe cases. Also by using a guided tissue regeneration agents like bonding of weak teeth to provide support. And finally, we have ongoing maintenance, regular follow-up visits, and cleaning and monitoring with the dentist. So I hope this video is at least a little bit informative and useful for you guys to understand about the periodontal diseases. So thank you.
Here we go, long ago, we were walk on the